Good morning, ladies and gentlemen of the media and the persons who are joining us online. Welcome to this media conference being hosted by the Office of the Leader of the Opposition. Today we have Dr. Karen Cummings, the Shadow Minister of Health, Dr. Nicolette Henry, Shadow Minister of Education, and the Honorable Annette Ferguson, all members of parliament for the APNU AFC coalition. Today we're dealing with another issue that is regrettable, which is the wanton and alarming spread of COVID-19 throughout many parts of Guyana, and what appears to be another spike in the number of confirmed cases and the number of deaths that are being recorded almost on a daily basis. We will have a statement from Dr. Cummings, and then we will have remarks from both Dr. Henry and MP Ferguson. And as usual, we will take your questions. When we get to the questions, we will take questions that are related to the statement and the remarks. And then there may be a few questions you will have the opportunity to ask on matters that are not necessarily related to today's press conference. So welcome, and I now invite Dr. Cummings to present her statement. Dr. Cummings?
Good. Are you hearing me? Are you hearing me?
Yes, we are. Go right ahead.
Good morning, everyone, on this bright Thursday morning. I'm happy to be able to represent the APNU AFC, the coalition, as the Shadow Minister of Health, to bring you up to speed of our thoughts as it relates to COVID-19. As you know, COVID-19, which originated in the city of Wuhan, China, in November 2019, it continues to wreak havoc across the globe and is responsible for 217 million confirmed cases and 4.5 million deaths worldwide, although 5 billion doses of vaccines have been administered. The Americas is responsible for approximately 84 million confirmed cases and 2 million deaths. In Guyana, following the index case on March 11, 2020, the dashboard has shown an uptick of confirmed cases. It stands at a whopping 25,770 and 624 deaths as of yesterday. And alarmingly, there are 1,809 persons in home isolation. Now, it's interesting to know because at home isolation, you're expected to wash your hands with soap and water before and after eating and after using the washroom and the toilet, to cover your cough and sneeze, dispose of tissues, use alcohol-based hand sanitizer, avoid contact with others, and remain the 3 to 6 feet difference. And you would have known that in some cases, the persons who would have gotten 24 hours water, it has now been reduced to 12 hours. In some cases where there were 12 hours, it has been reduced to 4 hours. And some persons just intermittently. And so here we're talking of washing your hands and sanitizing with decreased water, let alone soap and others where there is a skyrocketing of the goods in the market. So it's really, Guyana is really, the Guyanese we're really in a dilemma. And so far also, there are 1,933 active cases, 34 persons in the COVID-19 hospital, which was touted to accommodate 27. I heard the minister says he's gonna try to accommodate 40, and he will make that to the maximum capacity. They are putting the cart before the horse. I would have thought that COVID would have been sometime now, and they would have put all of that, decided that, have a comprehensive plan, so that rather than thinking about that ad hocly and after the fact, now they're thinking of what the ICU should look like. Be that as it may, the Guyanese citizens are aware that COVID-19 hospital was made operable by the former APNU AFC coalition government. So thanks to the APNU AFC government for such foresight, forward thinking, and insight. Now, what do we know about COVID? Several theories would have been put forward with varying suggestions, such as its origin being from a wet market, to zoonotically being transferred to man via minks, as in Denmark, and the pangolins, to even contamination via the food chain. And now we are hearing of gain of function approach from the researchers, where scientists use animal viruses to affect humans or mutate animal viruses to affect humans, thus creating superviruses. The latter proposition is engaging the attention of scientists and researchers now. However, at this juncture, all of that is beside the point. I will concur that COVID-19 is with us, and that COVID-19 anywhere is a threat to COVID-19 everywhere. The threat is very real, as some of us have witnessed it in our own families. At this press conference, I will make 3 points that affect Guyanese citizens. Firstly, this government continues to act unilaterally as it makes pertinent decisions that involve the Guyanese citizens. It was Dr. Theodoros Ghebreyesus who said, as I quote, "This COVID-19 pandemic can be pushed back, but only with a collective, coordinated, and comprehensive approach that engages the entire machinery of government." The World Health Director noted that though COVID-19 is taking so much from us, it gives us something special, the opportunity to come together as one humanity, to work together, to learn together, and to grow together. The WHO Director further noted that the greatest drivers of COVID-19 is lack of solidarity and sharing. Now, the National COVID-19 Task Force, NCTF. The task force has failed of being a preventive service task force. It has failed to address the inequities in healthcare delivery, as seen in the administrative region, Region 6, when compared with Regions 4 and 10. You would have seen in Regions 4 and 10 just recently, as in this week, nurses, healthcare workers have been locked out of the gate from the tertiary, or one and only tertiary hospital, when compared to Region 6, when the converse was true. There has been little or no community engagements and cross-sector approaches, as staff members from the popular sectors are unable to work from home or utilize the rotation system. I am positive that the task force does not understand that there's a direct relationship between a person's health and socio-economic circumstance. Though systemic racism is evident, I challenge the government to work systematically to change this systemic racism to inclusion and consider the social risks, such as the impact of non-employment and the lack of transportation, which have been found to improve health outcomes. In other words, the welfare of citizens I'm talking about. I'm simply saying that the task force should give preventive service and address the social determinants of health. It has been established from time immemorial that vaccines are important, powerful, and effective public health tool for the fight against COVID-19. So you would recognize I'm on to vaccine. So the first point I wanted to raise concerned the National COVID-19 Task Force, and now I'm on to vaccine. The main objectives when vaccines are considered are safety and efficacy. And in Guyana, the types of vaccines that are available, I was made to understand, include, in no particular order, AstraZeneca, Sputnik V, Sinopharm, Pfizer, Moderna, and Johnson & Johnson, or J&J as we know it. We have seen from social media fabrication, misinformation, and disinformation about the vaccine. I will reiterate that information concerning anyone's health should come from credible and reliable sources and must be evidence-based. Hence, we should follow the science and debunk the myths. The APNU coalition has been saying three main concerns concerning the vaccines. One, that we are not against persons being immunized. As you know, the opposition leader and myself, being the shadow Minister of Health, have gone at various parts of the country to encourage persons to be vaccinated, as COVID-19 has now become as the pandemic of the unvaccinated. To that effect, I traveled to Linden, which happens, I was told, to be one region of the lowest uptake of vaccination. So I traveled there with Nurse Cummings. Nurse Cummings happened to be the nurse who became famous. She was the one that administered to the US Vice President Kamala Harris, her vaccine. She was here in Guyana and in Linden to motivate citizens, especially healthcare workers, to get vaccinated and to prevent serious COVID-19 infections, hospitalizations, and death, and by extension, help to reduce the large burden of disease and the health crisis. As we have noticed now, there are several variants of interest and concerns, including the Delta variant and now the Mu variant. They've all been reported to be transmissible, very transmissible, and remaining at the more or less the level of the nasopharynx. But also, there are also variants of concern that they may be evading the immune defenses. Secondly, though the APNU-AFC coalition strongly recommends that the populace takes the vaccines, we are saying that it should not be mandatory. Even though there is a rush to herd immunity, the Ministry of Health should not coerce or mandate an action or behavior to interfere with an individual's liberty and autonomy. They should seek to balance communal well-being with individual liberties, and we are suggesting that there be a compromise. According to WHO, they have adopted a position that neither endorses nor opposes mandatory COVID-19 vaccination. Rather, they have identified important ethical considerations and caveats that should be explicitly evaluated and discussed through ethical analysis by governments and or institutional policymakers who may be considering mandates for COVID-19 vaccination. So the World Health does not seem to support the direction of mandates for COVID-19 vaccination, having argued that it is better to work on information campaigns and making vaccine accessible. In other words, the government and the Ministry of Health should seek to educate the public, educate the public about the vaccines and encourage the voluntary participation freely without threat. There must be ongoing communication to ensure comfort. We know there are conspirators and their theories, we know of that. We know there are anti-vaxxers. But I believe from the depths of my heart that most persons, especially our healthcare workers, they are neither anti-vaxxers or conspirators. They are just demonstrating some amount of vaccine hesitancy. I will not sit here and lie that there have not been any breakthrough cases infected with COVID-19. The studies would have shown that I know in the United States, 74% of those categories of persons who had breakthrough infections were over the 65 years and may have been immunocompromised. So I've spoken about the National Task Force. I've spoken of vaccination and mandatory vaccination. What's our take on it? And thirdly, I want to speak about or to let the population know that vaccine alone is not the solution. There must be a holistic approach to protect public health. And we must consider our health in terms of our diet. You know, there's an acronym that I use, the New Start principle, where we look at our nutrition, you know, the green leafy vegetables and healthy eating, promoting healthy eating. We look at our exercise, you know, going out in the sunshine, basking in the sunshine, avoiding the crowded spaces. You know, because the place is so extremely hot, your liquid, you know, try to have some more liquidity, increase your water intake, you know, take a lot of fresh air, try to rest, have 6 to 8 hours of sleep. And of course, whatever you believe in, you know, trust in divine power. So in other words, what I want to say as I close my statement, Guyana would want to achieve herd immunity, but not by violating the citizens' fundamental rights to peaceful protests, to choose to refuse and to deny them informed consent. With the data rapidly changing over the efficacy of these vaccines, and with disturbing adverse effects being reported that the vaccinated can both die from the vaccines, both the vaccinated and the unvaccinated can die. And also they can spread and become infected with the COVID-19 vaccine, the variants of concern. It will be untenable to promote mandatory vaccines or unleash harsh treatment and punitive actions on the subject, on that subset of citizens who may prefer not to be vaccinated. So I implore each citizen to practice the 3 W's, to wear your mask correctly, fitting properly on your nose, including your mouth, all the time, every time. To maintain watch your distance of the 3 feet to 6 feet, and to wash your hands as often as possible with soap and water or sanitize. After so many washes, you can wash your hands. I will also promote and add mental health and counseling services to the mix to safeguard public health of the citizens. So I just want to reiterate that although you may be taking the vaccines, you need to boost your immunity. Each person must boost his or her immunity by the diet, and there's some herbal foods, a lot of organic foods. So as a Christian, I know true science and the Bible agrees. Coercion is not a science. Withholding data is not science. Manipulating data is not science. Cherry picking is not science. Social conditioning is not science. Fear mongering is not science. And pharma propaganda is not science. So with these words, I thank you. Fear mongering is not science.
Thank you very much, Dr. Cummings, for your statement. I'll now invite Dr. Nicolette Henry to present her remarks. She will address specifically the issue of the planned reopening of school. Dr. Henry?
Good morning, Imran, and thank you, and good morning to colleagues, and good morning to all media personnel on this platform, and to those listening to us here in Guyana and beyond. This morning, I joined with colleagues to have this press conference to raise awareness of some of the worrying trends and developments that we're seeing here in country. I happen to serve in the education sector, former minister, and therefore I would confine most of my contribution this morning to the education sector. And so I begin by saying it is a grave concern to the coalition that the government is strongly proposing the reopening of school in less than 1 week. At the same time, when the same government is struggling with the escalation of cases here with coronavirus. So right away, we're seeing that they're operating from 2 extreme ends, none of which would be in the best interest of the people of this country, or none of which can result in anything positive for the people here. But in keeping with the reopening of school, there are a couple of things that I would want to touch on. And I trust that the media, in their responsibility, would definitely have quite a few questions for the government as it relates to the safety, health, and well-being of our students, teachers, and all stakeholders that work to make the education sector function. And so if schools are to be reopened, as is being touted on the 6th of September, there are quite a number of precautionary measures that, at least at this point in time, it would have been the minimum acceptable thing to do was to engage stakeholders at least a week in advance in some of these precautionary measures. And the first thing I want to talk about in terms of precautionary measures has to do with the rearranging of the seating. Because given the social distancing protocols, we would expect that students will not be overcrowded in classrooms. And these rearranging and seating arrangements need to be put out there in advance. We can't wait until we get on the ground, the students and the teachers, and then be figuring that out on the first day of school, because that will have serious consequences. The other precautionary measure that needs to be out there in advance has to do with timetabling. Are we to believe that all of the students are required to show up Monday morning when school reopens? Who are the students that will be identified? What is the system that will determine who will be going? How will they be notified? The public needs to know that. The students certainly need to know that, the parents. And then in terms of developing plans for the use and distribution of basic equipment and materials that are needed to sanitize the schools. And, such as the temperature check devices, hand washing stations. That brings me to the whole issue of preparing schools for reopening, even outside of COVID-19, would require some amount of infrastructural work, most of which we're not seeing in terms of putting up, hand washing bays and all those things. We're still to see that. We've seen some painting of other places from green to white. We'll be happy to see painting of schools also taking place in preparation of the reopening. We're talking about deploying staff to clean and disinfect and sanitize school buildings. And these ought to be done prior to. And so in addition to the regular cleaning, the ministry in this instance should be looking at services for professional cleaners so that they can ensure that the level of sanitizing, sanitation, and hygiene principles that are required are all met. Then coordinating the training of staff and students on implementing the various measures. That needs to be done prior to. Developing a monitoring mechanism to ensure that the precautionary measures that are put in place are never compromised. On the 7th point, I would want to touch on in terms of precautionary measures would be coordinating with parents and other stakeholders to ensure that transportation providers ensure the safe movement of our students to and from school. Where there is transportation support for students and families who may have, financial challenges brought on by COVID, this should be communicated, this should be handled. And so the ministry needs to say something about that. There also needs to be modified arrangement for the provision of meals. Will the students be running outside to buy meals during this time? We don't know. We heard about teachers will come up with an individual plan. Whatever plan is being determined for schools in this country, every child must have access to and be a beneficiary, if they are in school, of the precautionary measures that are outlined by WHO. It can't be left up to anybody to implement their own standards and their own precautionary measures. And the last one I want to touch on is preparing a space and appropriate protocols to isolate and treat students and staff who may become ill or show signs and symptoms of the COVID-19 virus while at school. And so for every school that is reopened and every school that has its door open, they would need at a minimum to have these 9 precautionary provisions in place. And these are not things that happen after or at, they are things that should happen prior to the reopening of schools. And so it does concern us in the coalition as we're not hearing about these precautionary measures that should be in place prior to. And therefore we call on the government and the Ministry of Education to ensure that they communicate to us, the people of this country, what are the specific plans for the reopening of schools in a time when Guyana is seeing an increase in the number of cases daily. I conclude with those words, and I'm certainly more than happy to have a discussion and questions that may arise out of my statement in the next few minutes. I thank you. Over.
Thank you very much, Dr. Henry, for a comprehensive statement on the issue of COVID and its impact on the education sector, specifically with regard to the planned reopening of schools. I now invite the Honorable Annette Ferguson, Member of Parliament, to add her remarks before we take your questions.
Thank you very much, Imran. A pleasant morning to you, colleagues, ladies and gentlemen of the media, and those listening and viewing us across the social media platforms. Ladies and gentlemen of the media, you will agree with me that COVID-19 is real and has become unmanageable by the People's Progressive Party civic regime since August 2nd, 2020. I also want to take this opportunity in reminding all of us that when the first case was discovered in March of 2020, and at the time, you had 1 death. At the time of the APNU AFC leaving office on the 2nd of August 2020, you had 21 deaths as is compared now to date with 624. Under the APNU AFC, you had 474 cases as is compared now 25,770. So that in its sense is saying to us that this particular pandemic has become unmanageable under the People's Progressive Party civic. As members of the main opposition party in the National Assembly, we are on record indicating to the regime that we are ready to work with the regime to collectively combat this pandemic, which is currently being mismanaged by the People's Progressive Party civic regime. Just before I end, I want to add by making this plea to the regime. We in the APNU AFC, we are ready to be consulted. We in the APNU AFC, we are ready to have representatives with the experience, competence, and knowledge to participate on the National COVID Task Force. Therefore, I end my brief statement by joining my colleagues in calling on the People's Progressive Party civic regime to put aside petty politics and move ahead in governing this country in the interest of our people, and also to ensure that we fight this pandemic together so that the lives of our people will be safe and secure. Thank you very much, Imran, and ladies and gentlemen of the media. That is my brief statement at this press conference this morning. Thank you.
Thank you very much, MP Ferguson, for your statement. Ladies and gentlemen, we will now move into your questions, and we will take questions first of all as regards the various statements that have been presented, and then if you have other issues which you would like to raise with the members of parliament, we'll be happy to take a few questions on those as well. So if you can use the raise hand feature to indicate that you'd like to ask a question, and we'll move from there. I see Svetlana Marshall, Village Voice. Svetlana, go right ahead.
Hi, good morning, everyone. I have about two questions. One to the former health minister, Dr. Cummings. Could you say, I know in the past the opposition would have raised concerns about the Sputnik V vaccine. Could you say if the opposition would have received all necessary clarification, and what exactly its position now on that vaccine that is being administered by the government? And I know that you mentioned a number of measures that could be taken, like wearing a mask, sanitizing, and things like that. The new COVID-19 emergency measures, or the updated measures, were released, I think, yesterday or the day before. What's the opposition position on that? We've seen increased capacity being given approval for increased capacity at restaurants and so forth. What is the opposition assessment of those updated measures? And to the Dr. Henry, could you say if the opposition or yourself would have attempted to reach out to the Minister of Education or the Ministry of Education to ascertain the level of preparedness, what exactly is being done on the ground? And if you haven't been able to do so, if you've been able to reach out to the teachers union or teachers, or have done your own assessment to determine exactly what is happening on the ground.
Thank you, Svetlana, for those questions. We will ask Dr. Cummings to respond first, and then we'll take the responses of Dr. Henry. Dr. Cummings?
Thank you very much, Imran, and thank you for the question. Of course, during our debate, the last debate, the budget debate in Parliament, it was pointing out, it was made on the APNU AFC and I guess the populace. It was made to understand that there was a shady deal when it came to the Sputnik V. You would have known it came through a middleman, and exorbitant prices. I think it was over 600 million extra money would have spent on procuring that vaccine. We haven't gotten any response. Of course, we'd have written extensively. The opposition leader would have carried, his fight to the Minister of Health and even to the President. But up to now, we haven't gotten any response on that. Sputnik V also, as you know, we would have preferred that most of these vaccines that are being used for our populace, because we want to put our people first, that it should be WHO approved. So far, Sputnik V has not been approved by WHO. It was posited that maybe later this month it would be approved. Of course, it's being used in other countries, about 70 countries. But in terms of what we want to do with something that's credible information, we want to hear from CDC and WHO. And so far, they have not approved that. I know CARICOM has approved traveling around CARICOM. You can, if you have Sputnik V, you're free to travel. I know I heard that from, I think, Ms. Motley herself. So that is where it is. And as we are in that, so when we're talking about mandatory vaccines, Sputnik V and all these have not been approved, should not, I mean, how could you, these drugs are under emergency, on the investigation and so on. So it shouldn't be mandatory. And so I've seen they have more or less played that down, and they have since brought Pfizer and J&J, which is a one dose. Of course, we have our interior hinterland brothers, and we know we have the mining there, and some of them are nomadic. So J&J, I guess, would be appropriate for that. But in terms of, as we speak, the only drug, I think, the only vaccine that has been FDA approved now, I think, is the Pfizer. So if there's any mandatory, if we to go that route, it should be the Pfizer we are mandating for. The others are not, are still under investigations, and they're for emergency use only. The second question, as it deals with the new public health measures, instead of as we see, it's worsening. The situation, the health crisis in Guyana is worsening. One would have thought that good sense would prevail, and would have taken the Ministry of Health and its team would have taken a step back and do some introspection and say, okay, where are the gaps? There are problems here. Let's see how put our might and main, not unilaterally, but let's work together in a coordinated fashion. How can we improve the situation? So here we are. There's an uptick in cases. It's skyrocketing, the deaths and the confirmed cases, and home isolation as well. And with no proper guidelines or brochures going home to say, well, these are the things you need to do. In addition to that, we have noticed that 60% capacity. So the super spread, they'll continue to be super spreader events. So you have now the business places and the casinos and so on can open up 60%. So I am it's very appalling to know, instead of us to tighten up, as we say, the reins and work on this thing, follow the science. Here we are, so it's, I don't know, it makes me wonder if there's something sinister, if there's going to be, the more cases we have, is more funding we're going to have. I mean, it lends itself to all sort of speculation, So, and coming to that, I mean, even sometimes as a former Minister of Health, I am trying to get some information to find the analysis, disaggregate the cases, how many, in terms of ethnicity, in terms of age, in terms of location. We're not having that, so we can have a proper analysis of the situation. So it's all they're interested in, just numbers, rather than identifying what the causes are and what problems we have, so we can fix them. So it's really, I mean, I guess it has to get worse before it gets better.
Thank you for your responses, Dr. Cummings. We'll now take the responses of Dr. Henry.
Well, thank you so much for the question. As it relates to if we as a coalition would have reached out to the Ministry of Education and to the government, I want to say yes, we have reached out. As you know, as a coalition, we as parliamentarians would have asked a number of questions through Parliament, and as former minister, I did ask a few questions myself relating to and directly related to the reopening of schools, among others, and also the measures that are being put in place to ensure that we continue to educate our students. Having said that, I would like to say that we continue to reach out, and I would even like to use this platform as a means to reach out again to the Ministry of Education and to the government. I can tell you that from my observation and from what I have been following and what is in public domain and what would have been said to me, that these measures that I spoke about, these precautionary measures, are not in place. And I want to give you one reason why I can say that without fear of being contradicted, as it relates to the preparation of our teachers to go back into the classroom. It is the Ministry of Education who admittedly said within the last 48 hours that they expect that 50% or thereabout of the teachers will go back to work. So if you require more teachers to be on board and you're operating with a capacity of half, 50 or less, and from my own thinking and from my own observation and my own information on the ground, it's going to be less than 50, given where the discussions and activities are where the union is concerned. So that in itself would tell you the level of preparation that can take place that will take place, if at all, and how prepared they are. So you have to be able to put your ducks in a row, so to speak, and make independent analysis yourself. You don't necessarily have to just go with what Nicolette Henry is saying, because at the end of the day, there is enough information in the public domain. There is enough happening that we should be concerned. Every right-thinking person ought to be concerned that school is about to reopen in Guyana when there is an increase in the number of cases in the country. Because that should concern you because of how the infection is spread. And you know that the Delta variant is very contagious, and there are high numbers reported among young people, and students are that age. So that should concern you. The second thing that should also concern you, and where you don't have to have specific data, but you have to be knowledgeable of your country's profile. And that is, we know that it's children from the age of 12 who are being vaccinated. But schools are not opening only for children who are 12 years and older. And we know that vaccine alone is not the end all to getting this pandemic under control. The precautionary measures are also very, 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 very important. And so if those things are not happening, if those structural things that exist are not addressed, and the structural interventions are not put in place, then we can clearly see where we are going. And we're colliding, with unfavorable outcomes at the end of the day. So that would be my response to your question. And I want to close this response by saying that I would even want to use this platform as a means of reaching out. I thank you. Over, Imran.
Thank you very much, Dr. Henry. Sean Embrack of News Talk Radio Demerara Waves has a few questions. Sean, go ahead with your questions.
Thank you, Imran. Are you hearing me?
Yes, we are. Go right ahead, Sean.
Okay. I don't know who will take the question, but it's a response to what the Attorney General, Mr. Anil Nandalal, said last evening. He said that the opposition politicians are responsible for driving the lawsuit that the union had filed against the government against mandatory vaccination and restricting public servants and citizens who are unvaccinated from accessing public services. That's one. And his second assertion is that the opposition stance on the mandatory vaccination will be the detriment of Afro-Guyanese and the coalition's base, especially against the backdrop or the background that the statistics are showing that persons ending up seriously ill in the hospital are mainly Afro-Guyanese. What are your responses to these statements by the Attorney General?
Thank you for your question, Sean. I am not sure if Dr. Henry or Dr. Cummings would like to respond. Of course, any response would have to be with extreme caution until any of Dr. Henry of the MPs who would like to respond would have had an opportunity to actually listen to whatever it is that the Attorney General said last evening, as you are indicating he did. Dr. Cummings or Dr. Henry or MP Ferguson?
So thank you. And I could, at this point, proffer an initial response from the coalition. First of all, I'd like to say thanks for the question. Secondly, I'd like to say that I have not had the opportunity to listen to those sentiments that were expressed. Having listened to them, we will give a more detailed response. But initially, what I can tell you is that the union, they have always been independent, and we are certainly supportive of the union's independence to bring these various actions in the court. And like every other Guyanese, we would trust that the outcomes of them would be to the improvement of the working conditions of the people here in this country. And so we will certainly prepare a much fuller response when we've had an opportunity to look at these statements. And I thank you for bringing it to our attention. Thanks again.
Thank you, Sean. I see Sean.
Imran,
Go
Imran?
right ahead. Go right ahead, Dr.
Yes.
Cummings.
No, not Dr. Cummings. This is MP Ferguson.
I apologize.
Okay, thank you very much. I will support Dr. Henry's point, and also wish to add that if the Attorney General has whatever information with regards to the opposition's involvement, why is it that he hasn't made it public? That's one. Two, we are on record. We are on record. Same to all Guyanese, because we represent over 218,000 in the National Assembly. And we have been saying to our Guyanese, one, it is your right to be vaccinated. We are not on record forcing our people. We have gone to communities. We went into regions, even phone calls. You have persons coming in at the leader of the opposition's office, and we have been sharing information with regards to the vaccination, the little that we have, because of the government not coming clean with its citizens. One, you cannot visit the ministry's website and get adequate information on the vaccines that are currently available to Guyanese. So because of lack of information, and the good book speaks about it, our people perish for the lack of knowledge. So if there's lack of information with regards to these vaccines, obviously you will have high vaccine hesitancy. And this is what we have seen. Because one is that, don't forget, it was the opposition that discovered on June the 14th, 2021 in the National Assembly, when we were considering financial papers 1 and 2. We discovered through the asking of questions about the procurement of these vaccines. And we were all alarmed how the Sputnik V was actually procured. And what we have been saying, what we have said to the government then, and will continue to say to them, is that put aside the 200,000 unquestionable vaccines, the Sputnik vaccine, and you can, continue to administer the remaining vaccines. But again, we are on record saying to our people, get vaccinated. But we are not on record saying to our people or trying to force them to get vaccinated. So I just want to add those 2 points based on, in addition to my colleague, Dr. Nicolette Henry.
Hey, Mariah, if I can come in at this point in time.
Please go ahead.
Yes.
Please go ahead, Dr. Cummings.
I've gotten to, I'm beginning to understand Mr. Nandalal, who thinks that he, I don't know, is a common GOD, and thinks he has all the solutions to all the answers. And I'm beginning to think that rather than confronting the issue, he wants to play the blame game. And so I don't think it will get us anywhere. I won't comment on what he has said. I haven't read it. And I mean, the quote, they can say sub judice, so it's in the courts. And so I don't want to get involved in that. But what I do know is that the rotation system, the public servants are mostly comprised and made up of one particular race, one particular ethnic, and that's the Afro-Guyanese. And so, when we were in government, we ensured that we had a rotation system whereby so many days.
Will be provided.
Hello?
Go ahead, Dr. Cummings.
Yes, so many days you come to work, you work from home. We accommodated persons to make sure that the work is done. We monitored the particular public servant and ensure that they give account of their stewardship at the end of the week. And so they had this flexibility that they could have worked from home, thus trying to contain this virus. And so right now, there's no kind of rotation system. You can't work from home. You're asked to come to work. And then when you come to work, if you don't come to work, you're supposed to show the PCR test, even though the Occupational Health and Safety rule says that if the Ministry of Health wants you to, they're requesting a test from you, they should fit the bill. You can't expect these public servants who have gotten no increase in pay to expect them to put the bill of the PCR test, which costs almost 100 US every 3 days. That's impossible. And so I also alluded to, when I gave my opening remarks, spoke about the National Task Force and the inability to cater for the welfare of the citizens and the healthcare workers. Development, Guyana, an oil-rich country, a budding one, development must not only mean an increase in wealth and businesses, but it must include the welfare of the people. We are the people. What is there for the people? When we were in government, we had transportation service. When they leave work, we had a particular transportation because, of course, they had problems with going to minibuses and people did discrimination and so forth. So we ensured that we had transportation for these persons, these nurses and so on, to go home. All right. So no rotation system. All right. And in addition to that, we're talking about inequities, access to vaccines. I recall going up with the same, I think, nurse, the nurse Cummings from the United States, who would have given the Kamala Harris the vaccine, administered it to her. The police stopped us. And the police stopped us, and we afterwards we let him know who we were. And he was, we tried to encourage him, did you take your vaccine and so forth? And he was saying, lo and behold, he got his first vaccine. And when he go for the second vaccine, it wasn't there. And we have gotten complaints also that, for instance, in AP and UAFC areas, where, for instance, in Linden, if there are 200 persons need a vaccine, like second dose or so forth, when it's being given, it's only 100 dose, half of the amount is being sent there. So there's some inequity in terms of that. So what I'm saying in short is that we take into account the socioeconomic status, and we are being deprived. We're having we're being wrong change, the bad end of the stick in terms of what particular race. And we have seen that in the COVID-19 cash grants. We have seen it in the rollout of flood relief. If you're not in a particular party, you can't get some relief. And so where are we going? Where is the mature politics? Where is the unity that we talk about? We can't talk as though people say it's spit in our mouth. The same gospel we preach to others we must be prepared to be the one that we're living by. And so that is to some extent, right, because of how we are being treated by this government, all right, as well as the inequities in terms of access to the vaccines, that I would say that's responsible for the high rise in the one particular race. But I still would like to see the data so that we can have our own analysis. Imagine data being deprived. And when you ask surveillance officers, when you ask persons, they are scared to give you information because they most times they may be African and they're scared of their jobs. They may lose their jobs. Where are we going? Where are we going? Health doesn't have politics. Thank you, Imran.
Thank you, Dr. Cummings. I see Sean Emrak has indicated that he has a follow-up question. Sean, go right ahead.
Yes, questions for both Dr. Cummings and Dr. Henry. I'll go with Dr. Henry first. Dr. Henry, I would like your take as a former Minister of Education. The current Minister of Education stance of just consulting with parents and teachers on the reopening of schools. And this is by our own words and confession that was on the news, right? Because she was quizzed by reporters, right? And our previous statement too, that the GTU is Curtis McDonald's party and they want to be political, so she would not consult with the union. And we have since seen a withdrawal by the union in assessing schools for reopening. And the minister said that she did consult with the teachers, and the majority of teachers favored face-to-face learning. what is your stand on the position of the minister going the route of talking to parents and teachers and excluding the union, who have a vital say and represent teachers across the country? And secondly, do you favor the model used by that Jamaica will be using, that after they would have vaccinated children between 12 and 18, to reopen school for face-to-face learning after 2 weeks? 2 weeks
Question
after
has to do
they're
with this,
fully
the
vaccinated,
new public health
or they would have received 1 dose. And for Dr. Cummins or Dr. Henry, we would have seen the push for the reopening of school by the Ministry of Education, who says that that advice is coming from Cabinet and the Ministry of Health. But then we would have seen yesterday that the Health Minister, Dr. Frank Anthony, confirming that yes, the Delta variant is here and there is an upsurge in cases and deaths and hospitalization and persons who are instructed to isolate themselves at home, but yet we see a push to reopen school. What are your take on this?
Well, thank you. And I think I can take both, and Dr. Cummins and it's, please feel free to add. The first response has to do with my view insofar as the minister comments would have been related to not engaging with our stakeholders. I've always held the view that whenever we function in senior offices, we have a duty and a responsibility to the people that we serve to ensure that all that we discharge is the best that we could do in the particular circumstance. Having said that, I think the data, the record and history and all the good guidance and education is replete with evidence to show that in order for you to deliver the best possible education you can, given the resources that you have in any part of the world, you would need to engage with all of your stakeholders. I say all of your stakeholders. And the union, you know, they are a very important stakeholder in the education sector and in the delivery of education. And therefore, to not engage with any stakeholder, be it the union, be it parents, be it teachers, or be it students, it is not very wise on the part of anyone. And it will certainly lead to the detriment of the sector. There can be no good coming out of you deciding that you're just not going to engage with an important stakeholder or an important element because of how you feel at a personal level. You don't get to choose who you work with when you become a senior official, or which groups and which stakeholders. These are predetermined based on education delivery, at least in the region, if not globally. And so the earlier you can get yourself in line and be able to follow good practices, the more likely you are to get good outcomes. So I would say that insofar as my response is concerned, and I don't like to individualize these things because I just have a real challenge understanding why things cannot be dealt with in an objective way. It is the minister's responsibility to serve the sector. It is not the minister's responsibility to criticize and ridicule and call out different stakeholders because you don't like their particular approach. That doesn't have a place in good governance. It doesn't have a place in good leadership. It certainly doesn't have a place in good management and good learning outcomes for student populations. I would leave that there. The second question had to do with the Ministry of Education indicating that it would have gotten advice from Cabinet insofar as the reopening of schools are concerned. I have to say that I am not part of the government and I cannot determine where the ministry is getting its advice from. If the minister or the ministry say that it got its advice on Cabinet, then like you, I will have to go with that. What it does, it reinforces the point that the same cabinet seemed to be giving divergent views, because Dr. Frank Anthony is a member of the same cabinet who is coming the same day to say that there are increased numbers and they may have to expand the capabilities and the capacity of the hospital because there's a potential for overload. And in the same breath and the same day, you hear the minister saying, well, we're opening school, we're rushing students in, whether they're vaccinated or not, the under 12, cannot be vaccinated. So it's a recipe for disaster. And I'm happy that you were able to ask the questions to reinforce the point and to highlight that that enough thought was not given certainly into the reopening of schools. And it's just a case where we're seeing here this, our students will be senselessly put and be exposed to something that could be avoided if it's properly thought out. You did, in one of your questions, mention that if I had a preference for what is being done in Jamaica, I have to say that I've looked at what is being done in many of the other countries, and I've seen even on social media, someone would have put out a little matrix of what is happening in other countries. And so while I would have preferred Guyana to have its own individual approach based on what is happening in the country, I have to say that if I were to choose between the two options of what is available here in Guyana and what is available there in Jamaica as it relates to the reopening school, I would be forced to, in the circumstance, go with the Jamaican model because it guarantees more safety. But of course, I would have done my own tweaking if I've had an opportunity. But given that I'm given two choices, in the circumstance, it would be safer to go with the Jamaica model. Thanks.
Thank you, Dr. Henry. Dr. Cummings, MB Ferguson, would you like to add?
Yes, well, as you know, in terms of children, 12 to 18 and even younger, we haven't gotten enough data. We're now starting to, even in the United States of America, the metropolitan countries, we don't have enough data. There's lack of data in terms of the safety and efficacy of this vaccine. And so one thing we're thinking that we must put into consideration is public trust. And so with children, and so you're very careful where you want to mandate, vaccines that are emergency authorization only. You'll want to ensure that it's FDA approved. And so, but I think it shouldn't be a condition for attending school. That has another side of it. We have seen that there's an increase. I mean, just without no proper data, there's some alleged that there's increase in teenage pregnancy and so forth. So there's some spin-offs from that. And so I will think you need to build a trust, speak to the parents, as was mentioned earlier, widen the talk, speak to the parents, have stakeholders involvement and have think tank and to get information. But I think you have to build the public trust, and right now we are mandating for school and it's still in emergency use, so we have to watch that. It shouldn't be under ethical consideration. It's not like the polio vaccines and these measles that when at birth you have BCG and all these kind of things. This is a different vaccine. And so we have to be very careful even in our rush for herd immunity. So we just have to take those considerations into being.
Thank you,
Imran.
Dr. Cummings. Go ahead, MP Ferguson.
Thank you very much, Imran. I would support the points elucidated by both of my colleagues. But I want to add on the first question, which was also answered by Dr. Nicolette Henry, with regards to the consultation of the key stakeholder, which happens to be the Ghana Teachers Union. Look, MP Coretta McDonald is an elected member in the Ghana or on the Ghana Teachers Union body. I say that to say to you and to remind the members of the media that during the COI on the sugar on Ghana Sugar Corporation in October of 2015, the union, GAU, that represents the workers there, they were consulted. The late Komal Chan was consulted. Even when the thought was put into the closure of a few sugar estates, the union was consulted by the then government, the APNUFC government. I have before me here a copy of the COI dated October 2015. And the members that made up the commission. And here you have Mr. C. Paul Narain, who is currently a sitting member on the People's Progressive Party Civic in the National Assembly. He was being a member of GAISUCO, the Agriculture Workers Union. He participated. So I'm saying all of this to say to you that the Ghana Teachers Union is a key stakeholder and should have been consulted. Whether you like Coretta or not, at the end of the day, she was elected by her teachers to serve on the Ghana Teachers Union. So I would want to join my colleagues and to say to the government, the Honorable Minister of Education, that you need to really desist from petty politics and develop mature politics to move this process forward. Thank you very much, Imran.
Thank you very much, MP Ferguson. We've been going for just about an hour and 45 minutes. Are there any further questions before we wrap up? Sean, I see you have your microphone on. Do you have another question?
No, Imran, sorry.
Okay, fine. Ladies and gentlemen, I'd like to thank you for joining today's press conference. But before we wrap up, I'd like to ask each of the members of parliament to take 1 minute to share with us your closing remarks. And we'll start with MP Ferguson, followed by Dr. Henry, and then finally Dr. Cummings. MP Ferguson.
Thank you very much, Imran. Imran, quickly, I would just want to reiterate my points I made earlier and to say to the regime, more so the Ministry of Education, that we are ready to work with the government and to also participate on the task force to ensure that our people are safe and the lives of our people are protected. And finally, I would end by saying to all Guyanese, whatever you do, kindly ensure that you have a responsibility as an individual to protect your family and to protect your loved ones. Therefore, we in the opposition would like to encourage you to continuously wear your mask, wash your hands, and watch your distance. Thank you very much, and may God bless us.
Thank you, MP Ferguson. Dr. Henry.
Thank you, Imran. I'd like to wrap up my contribution this morning by saying that we call on all Guyanese to ensure that they do their own due diligence to protect themselves and to protect their families and to protect their loved ones, because they come to a time when you realize that those that are entrusted with the responsibility to do so, for whatever reason, they have not been able to step up. So you certainly will have to take your own individual responsibility and to ensure that you're practicing all of the precautionary measures that were put in place to protect you during these pandemics. This morning, I touched on some of the precautionary measures that we ought to take in the education sector in order to ensure that if schools are to be reopened on September 6th, that it would be safe for our students. Time nor the scope of our discussion did not allow discussions on many other things that are not working well here in Guyana. But I do want to use this platform to ask you to be safe, not only from COVID, but in terms of the crime situation that is escalating in the country also. I ask that you take all the safety measures we see now in Berbice in particular, I saw a religious leader who was killed. We wait to see how that will be handled. And we see many other criminal activities increasing around the country. I ask that you take good care of yourself and your loved ones during these extremely challenging and difficult times. I thank you.
Thank you very much, Dr. Henry. A very troubling situation with regard to crime, and certainly we'll have to have a dedicated press conference on that issue as well. I'll now ask Dr. Cummings to make her final concluding remarks.
Thank you very much, Imran, and for the questions that surfaced. I would like to close by saying that we definitely would want to have a preventive service task force, which involves there's a lot of stakeholders involvement, including the opposition, community engagements, with cross-sector approaches, as I alluded to earlier, and they must denounce systemic racism and instead replace it by inclusion. All right, and they must be able to realize that there is a direct relationship between the social determinants of health and in terms of health outcomes. I also want to encourage the government to step up in terms of the public education, the campaign, so that vaccine hesitancy, more healthcare workers would come forward, because of course the healthcare workers, the public trust them to come to them at health facilities. Health is decentralized, so it's be it a health post or health center, they'll come to the nurses or the staff nurse or whoever it is that manning those facilities. And so they have to try to avoid the vaccine hesitancy. But of course, like everything else, we have to ensure that there's public health campaign and allow them to process it quickly so that they can able to step up. Finally, I want to say that vaccine is not the only solution, and you must take into consider a holistic approach in terms of your diet and your exercise. And so I just want to ensure that we have the 3 W's: wash your hands, sanitize, wear your mask, and watch your distance. In terms of the government, I'd expect them to step up in terms of the surveillance, active surveillance, in terms of testing, contact tracing, and treating the patients, the treatees, testing, tracking, and treating. They need to step that up. And also they need the 4 E's in terms of engaging persons, encouraging persons to be vaccinated and to take their health seriously, and to explain to them, and then finally enforce the law. So I want to close with a word from the WHO director that the drivers of COVID, for us to contain this virus, but has to take into consideration solidarity and sharing. And so we must work together, TEAM, together everyone achieves more. And so we have a nation to build, and I would like our citizens to be healthy. We want the public health mantra is healthy people and healthy communities. And if we work together as a team, that is doable and it is achievable.
Thank you, Dr. Cummings. I'd like to express profound thanks to Dr. Cummings, Dr. Henry, and MP Ferguson for hosting today's press conference and for treating with the issue of the alarming spread of COVID-19 across Guyana, and specifically the issue of the planned reopening of school on Monday, September 6th. I'd like to also thank the members of the media and the many persons who have joined us online for this press conference. We trust that you will have a good rest of the week, and we'd like to finally end by extending best wishes for a happy and safe Indigenous Heritage Month to all our Indigenous brothers and sisters.